Namaskaram. So, we will talk about a very important disease today, which is called deep vein thrombosis or DVT. Generally, there are two types of blood vessel in the leg. One is an artery, one is a vein, and the artery is responsible for bringing the pure blood to the leg. The impure blood from the leg goes to the heart through veins, and there are two types of vein. One is a superficial vein just below the skin. One is a deep vein which is just near the bone, deep inside. And the deep veins are basically the antitibial vein, postertibial vein, peroneal vein, the popliteal vein, superficial femoral vein, common femoral vein, external iliac vein, common iliac vein, like that. So, there are situations when there is a clot formation in the deep vein. So, there is a deep vein thrombosis which is called as DVT. So, DVT is a very common disease nowadays, especially post COVID, and because of deep vein thrombosis, the patient will present to us with swelling of the leg, sudden swelling of the leg, redness, pain, and difficulty in walking. So, these are the symptoms that the patient present with when they are suffering with a deep vein thrombosis. And one of the most serious consequence of acute deep vein thrombosis is the clot which is there inside the deep vein might migrate up to the lungs, causing a condition called pulmonary thromboembolism. Pulmonary means lungs, thromboembolism means the clot moving from somewhere into the lungs. Embolus means a thrombus which has moved from its native source to a distant source. Suppose you have a clot here, we call it as a thrombosis. If that clot moves into the heart, we call it as a thromboembolism. The thrombus has embolized or moved, migrated somewhere. So, pulmonary thromboembolism is a consequence of deep vein thrombosis. Now, I told you how to identify the DVT just by seeing the patient who is having a painful, swollen, red colored leg, difficulty in walking and severely painful limb can have DVT. Diagnosis is fairly simple. After the clinical suspicion, you have to do a Doppler scan or duplex ultrasound scan. The Doppler will 99% of the time will tell us whether there is DVT or not. Now, what are the treatments for DVT? The first and foremost, we have to understand that how extensive is this deep vein thrombosis. If the DVT or the clot in the deep vein of the leg is small and confined to areas which is below the hip joint, probably medical management is sufficient. But if the clot has migrated or the clot has extended all the way towards the abdomen, towards the iliac vein, external iliac vein and common iliac vein, or into the inferior vena cava, then it is a very dangerous type of DVT because they are very close to the heart. Anytime they can migrate into the heart, from the heart they can be pumped into the lungs, causing pulmonary thromboembolism. And once a patient suffers from pulmonary thromboembolism, 50% of them, they can die of this disease, pulmonary thromboembolism. So, it is so dangerous, that is why we have to be careful. So, first of all, suspect deep vein thrombosis of the leg if there is a sudden onset pain, swelling, redness, difficulty walking. And the ultrasound will be done, and the ultrasound will tell us, or the Doppler ultrasound will tell us whether this clot is below the hip joint or above the hip joint. If the clot has migrated or extended all the way up to the hip joint, then probably you are in a dangerous situation. Now, how do we treat it? If the clot is very small below the hip joint, the anticoagulations like Lexin, like Fragmin are good enough, and also we have NOACs, neuro-oral anticoagulants like the Xarelto, like the Apaxban, and the Rivaroxaban, like the Xarelto that we talked about, or the Daviclot, that is the Dabigatran. These are good enough treatment. But if the clot has extended above the hip joint into the iliac vein or IVC, what we do is we put a IVC filter. The filter will prevent the clot from migrating from the IVC, the iliac vein, into the heart, hence preventing a pulmonary thromboembolism. If we put a IVC filter, 99% of the time you will be able to prevent a pulmonary thromboembolism, which is because of lower limb thrombosis, venous thrombosis. Okay? And once we put the filter, then we remove the clot by thrombectomy, thromboaspiration. There are pharmacological mechanical, pharmacomechanical, and then aspiration, multiple ways to take out the thrombus. If you don't take out the thrombus, then the patient will have PTS, that is post thrombotic syndrome. That means the swelling will not reduce completely. The patient might have ulcers in future, and non-healing ulcer, pain, and the redness will be there. So the complete treatment of DVT in acute stage is putting a IVC filter if the DVT is extensive, and taking out the clot by the various methods that is available to us. So if you have a DVT, consult your doctor, get it treated, because if it is an extensive disease, extensive DVT, it can threaten your life. If it is not, still you need treatment, because otherwise the swelling of the leg, the post thrombotic syndrome will trouble you for a long time. Thank you and take care.